So one of the studies, they looked at how much dietary fiber intake people had, and they found that the people with higher fiber did better. In fact, for every 5 grams of fiber a day people consumed, they had a 30% lower risk of progression of their melanoma or death.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff. Hello, everyone, for the Learn Skin podcast. It's going to be just me running solo. Hadar is in the depths of Japan getting his learning on with the dermatology conference that's out there. So it's just going to be me, but it's not just me. That's the good news, because, if you had to listen to me for 25 minutes, God knows what I'll be talking about. But today we're going to be talking to an integrative dermatologist, Dr. Steve Daveluy. He's an associate professor and program director at Wayne State University in the Department of Dermatology. Really, I think, Renaissance guy, and the most distinctive mustache in all of dermatology, hands down. And he focuses on things like complex medical derm, HS, and has special interests in education, teledermatology, of course, integrative dermatology. He was alumni of the integrative dermatology certificate program. And probably the most interesting thing besides the mustache, which we're going to ask you about, Steve, is he's certified in laughter yoga and tries to bring joy to everything he does, and it's infectious. Steve, welcome to the podcast. And I got to ask you about the mustache, man. Where did it come from, and how did you get into that?
Thanks for having me. It's funny. I kind of started with the beard. So I started growing my big, long beard. And then I thought, all right, now I got to do something with the mustache. So then I just kind of self-taught. And of course, like everybody else, go online and look things up and learn to do the mustache wax. But I'll say one of my success stories from being part of the Integrative Derm Certificate program is that I now make my own beard oil, and it's infused with neem and bringarage.
Oh my gosh, that is just awesome. Amazing.
Yes.
And the reasons why: the neem is probably antimicrobial, and the bringarage has been shown in studies to enhance hair growth, right? So your hair must be luscious now. You're like a walking facial L'Oreal commercial, my friend.
Yes. When we're in person, you can touch it and feel how soft it is. Everybody loves to.
Give us just a little background. How did you get into the integrative space? I mean, obviously, you're a board-certified derm, and you've got some hardcore medical interest areas, be it complex medical derm or HS. Why integrative, and what inspired you?
I was kind of always interested theoretically in the integrative space, sort of adventuring and learning things for myself, and then trying to figure out these things, because I would have patients come in, and the thing I hated most is when they would ask me about a supplement or a dietary change, and I just couldn't help them because I had no information about it. I didn't know anything. And then I heard about the Integrative Derm Symposium, and so I missed the first one, but I was there for the second one, and it was fantastic. It was just what I was looking for, kind of like helping me to learn these things, bring things home, engage in conversations with those patients. And then doing the IDCP was really great, because that I really got to go in depth. And now I'm super comfortable talking about diet, supplements, mind-body medicine, breath work, all kinds of stuff that has really paid off. And it's really funny. So like you said, I'm at Wayne State. I'm the program director, and the residents will sometimes be surprised. Like the other day, we had a patient who had a lot of anxiety and was having a tough time. And I said, oh, I practice Reiki. Would it be okay if I did some Reiki to help you calm down? And one of the residents, who kind of, some people don't really buy into stuff as much as others. But afterward, he said, I can't believe it. That really worked. I'm really glad that you did that for that patient. We were able to do her whole surgery, and she stayed calm and just breathed along.
I mean, that's amazing.
Yeah, so I love having those little opportunities to just fit it in with patients.
Well, speaking of fitting it in, I mean, one of the things that you've been certified in is you're a certified laughter yogi. So tell me about that. How does that work, and how is laughter now a part of medicine?
Laughter yoga. So I sort of stumbled into that. I was at a meeting and someone led a laughter yoga session, and it really changed me. Like you said, I'm a very happy, joyful person. So I love joyful things. And the concept of laughter yoga is, you may have heard some of that research where if you fake smile, it actually activates the centers of your
Exactly.
brain. Yeah,
Yeah.
that feel happiness. So you feel happy. So it's that same concept. Your brain can't really tell fake laughter from real laughter. So laughter yoga, you just get together with a group of people and the yogi leads you, and you just do sort of silly things and you let yourself act like a kid and you sort of fake laugh, but then it turns into real laughter. So one of my favorite ones is, you pretend you have a zipper on your mouth, and when you unzip, you laugh, and then when you zip, you stop. So you go and I can't even do it without laughing because it
Oh
just
my
makes
gosh,
me
we're
laugh.
gonna just be laughing here together.
Right?
I love it. Yeah, I mean, I've even done this where we just fake laugh with each other, with like another person, and then it soon becomes real laughter, and then it becomes uncontrollable. It's actually pretty funny.
Yes. And it's especially the laughter yoga, it's just these absurd things you're doing. So then you can't help but just laugh and you just feel like a little kid again.
Isn't that the best? I think
Yeah.
that's really what it is. You know what? Not only turning back time health wise, but turning back time maybe even just nostalgia wise. Very cool. Well, Steve, we were going to jump into a couple of things that were integrative. And I know that there were a few talking points that I really wanted to ask you about. So maybe let's get started with the first one, which is, you talk about increasing dietary fiber. And I know a lot of us have talked about this for blunting glucose spikes, or maybe, for example, helping with acne or maybe HS, and just incorporating that as a part of your regular lifestyle and dietary practices. But you also talk about how this can improve your response to melanoma treatment. So can you discuss that a little bit more?
Yeah, it's pretty amazing research. So, one of the big innovations in melanoma are the immune checkpoint inhibitors, these new cancer treatments that can activate your immune system to fight your melanoma. And sometimes they work really well, and some people don't respond very well. Well, some scientists noticed that it might be differences in our gut microbiome that are playing a role in people's response to it, which is pretty amazing to think
Wow.
that that is how much control our microbiome has over our immune system. So, one of the studies, they took people who weren't responding and they actually did a fecal transplant where they took stool from people who did respond and gave it to the people who didn't respond. And some of them were then able to start responding to the therapy. So then they said, all right, the microbiome has something to do with this. So then they looked at fiber, because fiber is great. It feeds our gut bacteria and you get lots of good, healthy bacteria. It keeps everything humming down in your colon and everything going great. So they looked at how much dietary fiber intake people had and what their response was to these melanoma therapies, and they found that the people with higher fiber did better. In fact, for every 5 grams of fiber a day people consumed, they had a 30% lower risk of progression of their melanoma or death.
Wow. That's actually really fascinating. Did they identify what the players were in the gut microbiome? Because I think we're at a stage now where, like these fecal transplants, it's hard to know exactly what, because they're taking the whole community. Any insight that the authors had on what might be driving these shifts?
A little bit. So that some of the studies, they really tried to look at that, because their theory was, well, what if we could give it with a probiotic that had these good strains that were like the key? So they said there was a lot of variation across cohorts. So they're still trying to pinpoint, all right, which ones are the ones that are really dictating a good response? But they found a few that were kind of common. And one was B pseudocanalatum, and then some Roseburia species, and of course,
Yeah.
Akkermansia, our good old friend Akkermansia, who's just so good for your gut.
The question is, what is it that they're secreting, or what are their byproducts? I know we talk about short chain fatty acids, but it will be interesting as research continues to grow and we start to identify, is it something that was maybe stimulating the immune system? Is it a secondary metabolite? Maybe all of the above. I don't know if you have any theories on this, Steve, that you'd want to talk about.
It fascinates me too, because we spend a lot of time talking about inflammatory skin diseases and immune pathways. And to think how many of these are tied to the gut microbiome, and maybe that is really dictating, like, how many other therapies do we do to influence the immune system, and maybe instead of exciting it, to calm it down for psoriasis, for HS, for eczema. And maybe we need to be looking a little bit more at the microbiome in the gut and doing more of these studies to say, hey, the people who are responding really have, more fiber in their diet or more diversity in their gut microbiome. It fascinates me how much the bacteria in our gut really interact with our bodies and our immune system. It's not just a tube that goes through us and carries food and we extract nutrients. It's a whole environment. And we are so codependent on each other for our health that it's just fascinating.
Is it codependency or is it love, Steve?
Love, love. That's true. We're in a committed relationship.
Yeah, right. Well, one of the questions I've always wondered about is we try to state like what is a healthy gut microbiome, and it's been an elusive question because there isn't one signature that we've been able to say, okay, this is it. But then you have these sort of studies that say, well, clearly some kind of gut signature is better than others. I really wonder where we're going to head as we go along. And then what is the contribution of our diet? And some of that's maybe even culturally based on what we eat. Was there any thought about the confounders of diet in that study, or did they look at that? Do you know?
That's this study. They kept it a little bit simple
I
because they
see.
were mostly just asking people about their dietary intake, sort of measure it, but they didn't get super specific on it. Some of the earlier studies where they looked at the microbiome, they did try to sample cohorts from kind of different areas of the world. And it's like you said, they found very different compositions of the microbiome, which made it a little harder, like you said, to find all right, who are the best ones? Well, it looks like maybe if you live here, these are the best ones. And if you live here, these might be some good ones. And if you live here, and like you said, I think it varies a lot with our diet. That's where these bacteria are kind of hanging out. We eat the food, then we're feeding the gut, and they're kind of eating different things. I do know it's good to have lots of diversity. I'm a big fan of trying to eat 30 different plants every week to feed the diversity of my microbiome.
Yeah, I think that, and that's your point, is incorporating more fiber can be agnostic to whatever diet you have and just trying to augment the fiber that you're getting in. So very interesting stuff. Well, why don't we turn our attention to omega-3 fatty acids? I think there's been a lot of interest in that supplement, especially in the area of dermatology. Can you tell us a little bit about how that might relate to? And I think the two talking points you wanted to cover was acne and psoriasis. So tell us what we need to know about omega-3s.
Absolutely. So omega-3s, they're definitely a good guy. We talk about our omega-3s and our omega-6s, and our omega-3s are like our fish oil is a good source. And then the omega-6s are the ones they're more pro-inflammatory. So like you said, there's a couple of derm diseases and derm treatments that can be complemented with omega-3s. So they did some research looking at psoriasis, and we know psoriasis can come along with sort of the metabolic syndrome, increased cholesterol, increased heart disease risk. So increasing your omega-3s and reducing your omega-6s is a good idea if you have psoriasis, probably a good idea for just about everybody. They looked at a trial of using UVB light therapy, so one of our phototherapies, and they found that they had one group who just did the light therapy, one group who also took omega-3 supplements. And what do you know? The omega-3 group did better in terms of clearing their psoriasis, the erythema, the thickness, the scale. And they did another study looking at topical vitamin D creams and psoriasis. And again, they did better in the group that had omega-3s on board. And then the last one, they actually took it. This is a more recent one where they looked at 44 obese patients. So they were all obese, and they did either a biologic or a systemic therapy like methotrexate, and then one group omega-3s, one group just their regular diet. And they found that, of course, the omega-3 group did better in just about every measure. So if you're taking a biologic for psoriasis and you're not already taking an omega-3 supplement, it might actually make your medication work better.
Wow, this is really fascinating because, up until now, a lot of the studies had been just omega-3 as a singular supplement, monotherapy, and then, you can make a conclusion, yes, it helps or doesn't help, but this is different. This is like the true way integrative medicine was supposed to be done, which is you give them a supplement, and then you add on another therapy and see if the two are synergistic versus not being present. Really fascinating. I am really fascinated, by the way, about the phototherapy one. What do you think is going on there? Did the authors think about what the mechanism of action was there?
They didn't postulate too much. It was a pretty small, simple study.
I see.
But it is really interesting because we know that the omega-3s have an anti-inflammatory effect on the body. So that's got to be good for inflammatory diseases. Now, I don't know if there's any specific sort of interaction in the skin because that's, really think about light therapy as a skin-directed therapy. And
Right.
so the omega-3s are kind of fighting the inflammation from the inside and the light therapy is fighting it from the outside. But who knows at that interface, how do the omega-3s influence the keratinocytes or the immune cells within the epidermis that are sort of modulating a lot of that psoriasis or in the dermis? So it's really interesting. And what I like about these studies is that it's a very easy thing to recommend to patients. You tell them, hey, we're going to put you on this medication. If you take some fish oil, it'll work even better. And you're just going to be healthier anyway. How many times do you get to recommend a treatment to a patient and go, oh, side effect wise, don't worry about it. It's not going to hurt you. It's good for you anyway.
Well, what's really interesting about omega 3s and maybe even being more broad about eicosanoids, many times we think of these fatty lipid mediators as being inflammatory, but there's been a lot of work done by the late Vince Zibo, who was one of my, I worked in the lab of Dr. Rivka Isroff, who is one of my mentors, really made a huge difference in my career. Actually, I have to say one of my inspirations. And one of the mentors that she had, which I had the opportunity to meet, was Vince Zibo. And he did a lot of work on eicosanoids, and they independently had anti-inflammatory effects and were able to modulate the skin barrier and keratinocyte function in psoriasis. So I wonder if there's some sort of synergy that's working here between the UVB therapy and also the omega-3s. Steve, I've never thought about adding omega-3s with phototherapy, but you better believe that it's like I'm a changed man now because of this conversation with you. I'm going to be talking to my patients about omega-3s. How much would you recommend that they supplement?
So 1 gram a day seems to be a pretty adequate dose, and that's what a lot of the studies had. And speaking of, one of the studies that wasn't psoriasis but was acne had people take 1 gram a day of omega-3 fatty acids when they were on isotretinoin. And this one, I feel like this one, a lot of derms do kind of know about because when you're taking isotretinoin, it needs some fat. It's lipid soluble. So you need some fat in your system at the same time for it to even get into your system. And I think if anyone isn't aware, when they did the FDA trials for isotretinoin, they would have people take it with a meal that had 50 grams of fat. That is as much as a very well-known hamburger and large fries from a fast food
Oh
restaurant.
my God, that's a lot of fat, my friend.
That's a ton of fat. And then we're telling patients, oh, we have to watch because your triglycerides might go up when you're on this medicine.
Yeah, no
Meanwhile,
kidding.
loading them up. So if you put patients on 1 gram a day of omega-3 fatty acids, not only did their triglycerides decrease, but they actually had fewer of the dryness side effects from the isotretinoin, like the dry lips, nose, eyes, and skin. So it seemed to kind of mediate that aspect of the isotretinoin, which is great because that's really the one I tell everybody, this is what you're going to get. You're going to be dry.
Wow, that's fascinating. Well, thanks for covering both psoriasis and acne. And I think the isotretinoin story is obviously an incomplete one if you're not thinking about other sort of supplements. And we ourselves are working on a large review, and one of these supplements that you add on is omega-3. So thanks for covering that. And then let's go to this area that I just think is super fascinating, actinic keratosis field therapies. And I think there's been a lot of work now looking at, hey, if you add topical vitamin D analogs along with the 5-fluorouracil, you get a better response. But you're going to talk to us about vitamin D being taken systemically and field therapy. So what's the latest research there?
Yeah, this is something that is blew my mind at first. And like you said, that story of combining the vitamin D analog with the 5-FU, I didn't buy it at first. I was like, this because you go from 5-FU.
You know what? I'm kind of like you too, Steve. I was like, how does that work? But
right? Yeah, especially you go from 5-FU, you need to use it for like 2 to 4 weeks, and now all of a sudden it's 4 days because you just add on this topical vitamin. I'm like, 4 days? That doesn't make any sense, but it
yeah,
really does seem to work that way. So, and I don't know if that was the inspiration for these studies to look at serum vitamin D, and they looked at it when they did it with photodynamic therapy, where we put on the sensitizer, incubate it a while, and then activate it with either red or blue light. And they found the first study just kind of measured serum vitamin D and compared responders and non-responders. and found that there were a lot more responders in the group that had higher vitamin D levels. So then they took it a step farther and they said, all right, we're just going to do one group that's photodynamic therapy by itself. And then one group, we're going to supplement their vitamin D. We're going to check it and supplement it. And if it was deficient or less than 30, they would give them 10,000 for 14 days. If it was greater than 30, they would just give them 10,000 for 5 days. So either way, that group got vitamin D.
Yep.
Lo and behold, they did a lot better than the group that didn't get it and just got the photodynamic therapy alone. So this is kind of a big game changer where you go, oh my, I need to worry about your vitamin D levels. And it's an interesting concept because I know you might not run into this as much in California, but here in Detroit, people have low vitamin D for at least a good part of the year if they're not supplementing, because we just don't get sunshine for about 6 to 8 months of the year.
You know what's fascinating to me is that vitamin D story was first there with 5FU, but then now we're going on to photodynamic therapy. So there's something inherent to field therapy that's augmented with vitamin D, just in general. So, and how do you do this if you're getting a patient on photodynamic therapy? Do you have them take the vitamin D by injection basically, or you load it up as an oral? What would be your approach there?
They did oral for the study. So
Okay.
that's what I've been sort of doing. And what's kind of nice with photodynamic therapy is we don't usually do it the same day. We usually run it by the insurance, get it all approved.
Yeah, that's true.
So I say, all right, start taking some vitamin D now, and we're going to schedule your photodynamic therapy. And that way you can get loaded up. I will say I haven't been checking it. In the study, they checked to see what their level was at.
I see.
In Detroit, I kind of assume everyone is low. So I just tell everybody, just start taking 1,000 units a day. But there are some people where I go, well, let me check. Or especially if we do one photodynamic, they don't really respond. I go, let me check your D. Maybe you're really deficient and we need to get you up.
Yeah.
And it's funny because they think the mechanism may be that the vitamin D actually enhances the immune reaction against the sun-damaged cells and the atypical keratinocytes, which is really fascinating when you think about the fact that sun helps the skin to generate pre-vitamin D, that it's sort of a protective mechanism in a way, this sun is damaging me. Let me make some vitamin D so I can help fight it off. But it's just not quite the right balance.
That's a really interesting point. Well, Steve, listen, you covered 3 topics, which is just the tip of the iceberg when it comes to integrative dermatology. I am very, very excited about the upcoming Integrative Dermatology Symposium. It's going to be in Reno, October 27th through the 29th. And then, Steve, you are one of the co-chairs for the event, along with Dr. Hadar Levtov, who wasn't able to join us today on the podcast. But nevertheless, can you tell us a little bit about what's got you excited about the upcoming IDS?
Oh, so much has me excited. It's going to be such a great meeting. We're focusing on nutrition as our theme. And we are planning, I don't know, how much am I allowed to spoil for people?
Well, I think you can spoil a bit. We've got a great keynote speaker. I want to hear what got you excited.
Great keynote speaker. We've got some cool hands-on diet preparation activities ready that we're working on.
Awesome.
Yeah, we're really trying to keep things practical and tie them to dermatology and treating skin disease. At the same time, kind of covering nutrition because it's a big topic and hitting it from all different angles. So we're trying to have, people from different types of practices come and talk, from dermatologists to naturopaths to Ayurveda to traditional Chinese medicine, and really looking at nutrition from all kinds of different angles in terms of the microbiome, the immune system. So it's going to be very exciting. And of course, the food is going to be great when your conference is focused on nutrition.
Exactly. So if you want to come for Reno, do it. If you can't come for Reno, come for the IDS. If you can't come for the IDS, come for the food. If you can't come for the food, come for the program. If you can't come for the program, come so that you can check out Steve's amazing beard and mustache with his neem and bringaraj oil, guys. That's all I have to say. Steve, this was awesome. We'll do it again soon. And looking forward to more sessions with you.
Thanks so much. This was spectacular. Thanks for having me. Thanks everyone for listening.
Thank you so much for supporting us through the last several seasons. We love receiving your questions on social media. And now you can call them in as well.
Yeah, exactly. So if you're a licensed medical practitioner, call us at 424-309-8757 and leave a detailed recording with your name, location, clinical question, and it may just be chosen to be answered live on the next podcast.
We look forward to your submissions. And as always, stay curious.